Hi, I'm Bob Schrupp, physical therapist.
And I am Brad Heineck, physical therapist.
And together we are the most famous physical therapists. Speak up on the internet.
And our opinion, of course. Okay,
Right.
Bob, I'm speaking.
Hello? Could you speak up a little bit? Speak in the microphone?
Oh.
Brad, today we're going to talk about ultrasound. We just realized we're looking back on our videos and we've never done one on ultrasound. And this is, I would say, the most commonly used modality in physical therapy. Would you agree with that, Brad?
Probably, yeah. Chiropractors use it quite a bit
Chiropractors,
too.
and did you realize that this has been used since 1940?
No, Bob, I did not realize
I'm
that.
telling him things all the time that he doesn't know. So what's cool about this is it's a very common modality to use, and it's very easy to use, it's very quick, and I think it's very effective, especially when it's used with medicine, but we're not going to talk about that in this video. That's going to be the next video, which is we're going to talk about phonophoresis. So you may want to look at that one too. Nancy spelled it down below so you can see what phonophoresis is. But this is just regular ultrasound. Now this is different than, this is therapeutic ultrasound versus diagnostic ultrasound. You've all heard of ultrasound they use to determine the sex of a baby, or they're looking at your abdomen to see if there's a tumor or something like that.
Right.
Or looking at Brad's brain to see if there's a brain up there. But in this case, it's actually, there's a little crystal in here that vibrates real quickly and creates ultrasound waves, and it's going to do two things, Brad. One, it's going to heat up the area very deep, the surface, it's going to heat up the tissues to very deep. It goes all the way down to the bone.
Sure.
You know that, right? And the other thing it does is it heals. So it heats and it heals.
Right.
And it heals through, I didn't remember this actually, through what they call cavitation. You don't need to know that, but it actually works on a cellular level and helps the cells heal. So that's probably all that you need to know. But the way it works is that you put down a coupling gel, or what do you call this? You had a different name for it. Soluble, I guess it doesn't matter.
Aqueous.
Aqueous.
Yeah.
So let's say we're going to do an ultrasound on Brad's, let's say he's having a little lateral epicondylitis there. And
well, it's cold, Bob.
Oh, yeah, sometimes we heat it up.
Bob really likes to put a lot of
For
gel
people
on.
we like, and it creates a frictionless surface. Ooh, almost going to get on you there, Brad. And we have to keep moving it, otherwise the waves can actually penetrate so deep that they'll heat up the outside of the bone, and they get what is called periosteal pain. So if you see your therapist stops going like this and they start talking to somebody, make sure that they keep moving it, because you'll start to feel an aching. Normally what you are going to feel is just a gentle warmth, right, Brad? Some people say they don't think it's working because they don't feel much.
Right.
But it's working. It's doing its job. Usually about 7 minutes, 8 minutes.
Typically.
Yeah. So that's as simple as that. It can be used for, and I wrote these down because I didn't want to forget, bursitis, tendonitis, muscle strains and tears. I'm not done yet. Frozen shoulders, sprains and ligament injuries, joint contracture and tightness. Anything else you want to add to that, Brad?
I use it just if someone's, if they're inflamed and tender, I won't use it. But if they're tight and have some of those, a lot of those symptoms, it's really up to the therapist, so you really don't need to be concerned about it.
I use it if it's inflamed and tender, then I use the phonophoresis.
Right.
The regular ultrasound, no, to be honest, I hardly ever use the regular ultrasound anymore because I use the phonophoresis so much. But that's therapeutic ultrasound, and your physical therapist, chiropractor may be using it, and it's been used for a long time, so it's been effective. Good luck.